For more on World Health Day, lead physiotherapist and co-founder Health Better, Daniel Olubunmi, joins me on the news this hour. Thank you so much for joining us. Much have been said about
Thank you very
Nigeria's
much.
health sector, one of which is the primary health care performance. How would you describe the current state of primary health care financing in Nigeria?
Well, thank you very much. I think currently Nigeria is a bit off the mark in almost every sector of the society. The infrastructure is weak, the primary education is debased, and as a matter of fact, there's an inability to provide good and quality healthcare for millions of Nigerians. In Nigeria, access to good healthcare is a nightmare for most Nigerians, and it's one of the many reasons why Nigerians do not blend well with atheism. Here in Nigeria, we still have to pray for good health. But then the current state shows that there's enough ensuring that there's hardly falls on the government, and the government is always a problem. There's inadequate funding of the existing agencies, hospitals and other parastatals for optimal service delivery. And government cannot be kicked out of the struggle to provide good and quality healthcare because they have actually proven their ineptitude over time. But their role can be limited to certain areas to maximize values and impact. There are several aspects of the healthcare value chain that the government can actually consider to lead to either communities and other private enterprises. But at the same time, some opponents might want to argue that these will actually drive up the cost of healthcare.
Right.
But free market principles.
Dr. Olubunmi, very quickly, looking at some of these challenges, identified, how important do you consider government involvement in, primary healthcare financing, and what steps has the government taken in this regard?
Well, I think funding is very much important because at the same time, a lot of the government has actually paid so much focus on building physical structures, which is not so, because how would you build physical structure? For example, in Osun State, and the last administration, they built over 300 primary health care centers. And without them thinking about who are those people that are going to work there, the medical equipment, get what's it called now? The system, the people that will work there, then the services that will be rendered for the people. So you need to put all the sectors, all the systems into place. Then funding is very much important. So primary health care center actually goes beyond just like building physical structures. It's also like basically it's the solution is basically putting into place a framework operations also. So which is actually very important. So. Right. And I think that's one of the major challenges, inadequate funding of the hospitals and parastatals.
Right, so many issues, especially with government, leveraging technology to improve the primary health care service in Nigeria. Well, too much to talk about, but then we have to leave it here. Lead physiotherapist and co-founder Health Better, Daniel Olubunmi, thank you so much for your time.